final students are now just awaiting to start their internship. So you cannot ask them that you first go back and then wait if say Makerere University is to hold a graduation next year in February. It should not actually graduate you, but you are a student. Wait until you graduate. You will only graduate after you have done this training. And if you are private, we shall give you lunch. We don't know the package of the lunch, ladies and gentlemen. We are of the view. We think that actually we're welcoming lunch, but we're saying what is lunch? Because someone can give you lunch and it's 5 million. Okay? So we don't know what is the lunch, because lunch has been 1 million. Also oversee the processes of ensuring that the medicines are approved before they are put on the market through entities like the National Drug Authority, ensure their distribution through the NMS, the public facilities, and also in the community pharmacies across the country. And then we work together. They are members of the healthcare workforce, pharmacists, working together with other healthcare professionals in clinical settings and hospitals. So, and managing a patient is teamwork. Okay, so that's why you see all of us here, that for every care to be satisfactory, you need inputs from different cadres to ensure that the patient's needs are properly catered for. Concerning this policy, the National Education and Training for Health Policy, as stated, it is a policy that was formulated in 2025, okay, approved by Cabinet and drafted jointly by Ministry of Education and Sports and then Ministry of Health, but it is owned by Ministry of Education and Sports when you see the document. But the implementation, given that is the health programs, it is by Ministry of Health. The policy required the implementation standards and also implementation guidelines. So these were developed in 2026, just this year, approved in February, 26th February, where they came up with implementation standards and then implementation guidelines. So our contestation is, the policy has 6 objectives, and our contestation is on mainly policy objective number 5 that deals with what is termed internship, okay, in terms of internship training. So we note that under policy objective number 5, there is an intervention 86, and that intervention provides that in terms of welfare, the government is going to support only those who were being supported at the university, okay, as far as their welfare during internship training is concerned. And then the others can be supported by the means through which they were going through in school. And over time, this position has changed. The policymakers at some point in the press and other key members indicate everything has been scrapped so that we equalize. Then at some point we hearing statements say no, government is going to support those who are being supported, and then the private one will support themselves. And then we have again seen another statement in the media that the government the Ministry of Health has been directed to work out modalities of how to provide lunch for the privately sponsored students at the university who have now come to do their internship. So there is no formal position as far as the welfare of medical intern is concerned. So our concern is, one, that when we refer to the interpretation clause for the policy, it wrongly defines a medical intern. Okay? Acknowledges that this internship is critical. It is supposed to be done post-qualification, but the qualification can only be awarded by the university after the internship process. So in other words, you have gone through the medical school, okay? You completed all the requirements under the curriculum, and then now they are saying before the university gives you the degree, awards you, graduate, you should first undergo this training, this post-qualification training, yet you have not received the qualification for which you went for at the university, and treats this medical intern as a student. Okay, it is part of the training. Say you are a learner, you are a student. Those are the terminologies used. Intern, all those kind of things. So that's why we are saying no. If the problem is the nomenclature, even to confuse the public, because internship is a general term as has been explained, maybe let there be a change in the nomenclature to clearly indicate that, look here, this is not just placements, field experiences that have been done during the course of training. There is an academic requirement, there is a curriculum approved for one to receive a degree in that respect. So irrespective of whether you're Ugandan or you are not, you are going to go through that package of the curriculum that has been approved for pharmacy, for medicine and surgery, for nursing, for dentistry, okay, at the university. Once you have completed that, then you should receive your certificate at the university. We don't see the need why they should hold someone and say stay there until you undergo this additional requirement, which requirement is now a critical transition from you fulfilling the academic requirements of the training institution, the university. You are now wanting to be an independent practitioner. So, for you to be an independent practitioner, you are now required by law. This is not just a wish. The law requires that before you are registered to practice independently, you must practice provisionally under supervision of a named qualified registered professional in your field. So if it is pharmacy, there are requirements for you to be provisionally registered, okay? And then medicine and surgery, the same. That is, the councils responsible are going to give you provisional license to practice under a named registered person. So we are saying that it is a requirement of the law. So those who wish to fulfill that requirement of the law are the ones to apply to do medical internship. Not everyone who is at the university would wish to come and do medical internship. Maybe complete your bachelor's at the university, proceed and do a master's, a PhD, or continue and do other things. Get it? Or do the same practical training in another country, because this requirement is not just unique for Uganda. You're not going to go to another country and be registered as a medical doctor, or a pharmacist, a nurse, without going through these requirements. So if you have to fulfill the requirements there, then you don't have to be forced to fulfill the requirements of Uganda for independent practice. So that's why we are saying the first fault is on who is a medical intern. We say no, you cannot define a medical intern as a student. These are professionals who have completed their programs at the university. They know what it means. Then two, we are saying that when we look at your implementation standards, which were developed and approved 2026 in February on 26th, the implementation standard number 7 and 12 provides that wherever this practical training is being done, you must provide for the welfare of the trainee. Get it? Adequately, reasonable and adequate facilitation must be provided for the welfare of the trainee. That is the standard. The policy is there, okay? But it's saying, okay, whatever things you come up with for purpose of training, you must ensure welfare of the trainee, and it should be adequate and reasonable. I refer you to their implementation standard number 7.2 and 12 of this policy. So, what is reasonable is not to scrap what is currently being provided, which is even a minimum, as has been stated. It is not adequate to simply provide me with lunch. What is lunch? At CJ, what is the package of the what? Of the lunch. Get it? In any case, the 1 million I've been giving has been lunch, basically, which we appreciate, and we have been saying no, 1 million is not even enough. Even as they start the internship, the internship process itself, this money doesn't even come immediately. The interns have to wait for 4 months, and others have to strike in order even to release the what? Yes. So we appreciate the lunch that has always been given, because the lunch has been 1 million. I hope that has been what they are talking about. But now the requirement that please make it adequate and reasonable. If in 2021 there was a change and interns were paid 2.5 million shillings, you get it? Eh? And now time value of money, things change. Can you adjust? If the budget is really constrained, maybe we go by the 2.5, get it? Eh? Which was there, and then as we look back into these other aspects, we note that when it goes to financing mechanisms, as far as the implementation guidelines and standards are concerned, they have not provided for a vote as far as internship, medical internship training is concerned. They're actually providing for subversions. Yeah? Now, no ministry would want their budgets to be cut off as a, by the way, department, a government agency, in the budget that has been allocated, and then you say, no, I think this portion, we shall use it for internship. That partly explains why there is a struggle. They mean to say, we don't have money. Eh? Everyone say we don't have money. It is a subvention. So, if you are talking about at least providing a vote, a fund that is dedicated for medical internship, we will say, okay, you are now moving in the right direction to provide adequate facilitation for interns. There are proposals of co-financing, there are proposals of grants, and these are things we are saying that we should have had time to discuss. So when you go in the introductory part of the policy, it provides that there was adequate consultations from the various stakeholders, both in the public and private. And for us here, we say, no, that is a lie. That's why we are here. There was no adequate consultation. And therefore, using our professional judgment, we cannot support a lie. We are saying, no, consult the stakeholders. Get it? Let us have a discussion on these issues. You say in the policy, in your preambles, it provides that we have inadequate training facilities. Okay? The policy provides that there are few preceptors, supervisors. If we talk about consultants, we talk about these senior people, they are not there to supervise. The policy also recognizes, I invite you to look at the situational analysis of the policy itself, and the problem statement. The policy recognizes that even the current interns and non-interns are demotivated. And also the supervisors are demotivated. The policy does not provide for how to motivate even the supervisors. How do you motivate the interns who are there? The policy, when we go now to the implementation framework, when you look at now the guidelines for the implementation guidelines, specifically guideline number 35, provide it is not, when it comes now to welfare as far as internship itself is concerned, it does not provide the mechanisms on how you are going to motivate the supervisors, okay? How you are going to increase the number of supervisors. We have a public health structure approved by Ministry of Public Service, okay? But these structures remain largely unfilled. There are so many vacant positions which are not filled. Government itself is not advertising to fill up even the basic entry positions. A medical officer, a pharmacist, most districts, hospitals, general facilities, centers, and so on. They actually don't have these professionals. Where you have one person there, now he's loaded with so many things. So how is he going to adequately supervise the intern? We want to see the government's commitment by filling up all those vacant positions that we have in our public service health structure. Then we know, yes, now we want to ensure quality training of health professionals. But where they are not, then we know their welfare will actually cause more demotivation. The policy situational analysis indicates that we have those few training institutions as well, and supervisors, and recommends more training institutions to be established. At the same time, we are hearing statements in the public made by officials that we have many health professionals around. We are not matching our training needs vis-a-vis the workforce. Now, Uganda as a country, we don't simply train for Uganda. The universities don't only train for Uganda. We train for the region as far as East Africa is concerned. We train for the whole world. Most of our people who have trained in Uganda have gone to other countries and have made very significant contributions in those settings. So we must meet the needs locally, which we are not meeting. We have very few health workers. There is a shortage of health workforce in the country to meet the demands of the population, the growing population. In Uganda, for example, we only have 2,216 pharmacists who have been registered to serve 50 million people. Get it? Are you going to achieve 1,000 pharmacists to 1,000? How many do you need? Get it? At the same time, we are having students right now. We at the Pharmaceutical Society of Uganda, we maintain a database of all pharmacy students in the country. We have 9 pharmacy training institutions approved to train, and in these institutions, as of today, we have 2,721 pharmacy students in Uganda right now in various pharmacy schools, and 58.7% of these are male. The female students are 41.3% in Uganda. We are talking about STEM, science, technology. So now, when we are bringing on these numbers, the numbers are already adequate. When we do our analysis, this student number, first of all, is mainly in year 1 and year 2. Actually, they have now just crossed off because they are just finishing their semesters, most of the universities. So we talk about them in year 2, 69%. So the program is 5 years. So over the next 5 years, we are expecting this 2,721 to come out for training. Are this really much to worry us compared to countries that have thousands of these professionals? So what we're saying is the policy itself is built on misinformation, that there was adequate consultation. We said there was no adequate consultation. That is a lie. We do not believe in lies. The policy provides that the medical interns are students. We are saying no. Medical interns hold post, they are having already a qualification. Internship itself is a post-qualification training for purpose of you being an independent practitioner. So you are not a student and should not be treated as a student. The policy provides for implementation standards to cater for adequate and reasonable welfare of these medical interns. We are saying the implementation guidelines and what is being talked about in the media by the policymakers and various stakeholders does not reflect the will to fulfill this requirement of ensuring welfare of these medical interns. So accordingly, given that one, there is no curriculum review in this period, the interns run for 12 months, internship is for 12 months. The current interns are finishing the internship this month of July. We expect another cohort to start internship in August. In the absence of a revised curriculum, and for the fact that those who have gone through the university have already completed the curriculum which they were supposed to do, because most universities have already done their final examinations, the semester has closed, and the final students are now just awaiting to start their internship. So you cannot ask them that you first go back and then wait if say Makerere University is to hold a graduation next year in February. It should not actually graduate you, but you are a student. Wait until you graduate. You will only graduate after you have done this training. And if you are private, we shall give you lunch. We don't know the package of the lunch, ladies and gentlemen. We are of the view. We think that actually we're welcoming lunch, but we're saying what is lunch? Because someone can give you lunch and it's 5 million. Okay? So we don't know what is the lunch. Because lunch has been 1 million so far. Yes, that is being given. That's not actually a salary. They have been providing lunch to interns already of 1 million facilitation. And they have been struggling around with this package of 1 million. And some have even gone unpaid for one reason or the other. So they have missed even the lunch which already they were giving to help them settle in here and there. So if you are going to dictate where to deploy this profession, you must provide, if the name of the facilitation is called the lunch, then let it be adequate lunch, and we are saying let this lunch not be less than 2.5 million shillings for the interns. And two, we are saying that also look into revising provisions that do not cater for the welfare of the supervisors. If you are on the ward and you are crowded by intern as a supervisor, what kind of training are you going to give to those people? Too much. Our pharmacists also go to the industries because they make medicines for us. Now, if you don't cater for them, it is for the good of the country. How are they? They are going to come out, they are going to make for you fake paracetamol, panadols, and this metro you take. You are going to go to the hospital, and this intern is a pharmacist intern, supposed to guide you on how to use the medicine appropriately, and does not even give you any advice on it, just dumps. If they give you a suppository medicine which is supposed to be put in the rectum, you are Instead, they tell you swallow it because the person is demotivated. Don't complain. This matter is not just about interns. Get it? It is about all of us, the public, everyone. Get it? If we tell you when you are taking ciprofloxacin in medicine, do not take it together with milk, because it is going to be like a stone. It will just pass through your stomach. Supposing Dr. Frank prescribed Cipro for you, and the intern pharmacist does not advise you when he's giving it to you, at that point, you're going to come back and overload the health facility again, because you think you are not fine. This morning you took some tea or coffee. This tea and coffee contain some compounds we call the purine alkaloids. The most common purine alkaloid is caffeine. All of us here commonly know caffeine to stimulate your system, the central nervous system, brain, your spinal cord. So, but beside that, that also depends on the dosages they're supposed to advise you. Besides that, there are other compounds in the tea and the coffee, which are also purine alkaloids. One common one is theophylline. So theophylline is a compound that dilates your bronchioles. You are able to breathe well when you take it. For us in the laboratory, we treat theophylline with a chemical called ethylene diamine and heat it. When we heat it, transforms theophylline to aminophylline. So aminophylline is a medicine which is used to treat asthma. More of it will be absorbed into your body because aminophylline is 20 times more soluble than theophylline by virtue of that transformation. Now, if doctor prescribed medicine for you as a patient and he has prescribed aminophylline to be used on you as an asthmatic patient, and you go home and you are also using tea, these are common things, tea, coffee, and so on. I'm supposed to guide you on when to use them so that you don't affect the treatment regimens. Get it? So that's why we're saying this is a team effort, and everyone must be adequately facilitated to do their work well. Get it? You know adrenaline in your body and fright and so on. But adrenaline is also a medicine. Get it? But you know that from our pharmaceutical perspective, adrenaline is not supposed to be exposed to light. Get it? It undergoes some form of oxidation. So the colorless liquid will start turning into yellow, another compound turning into brown, brick red. Now, if you are with the nurse and he's going to administer adrenaline, and how the pharmacists they are together, will say, no, but let's look at this in terms of stability of this medicine. Get it? And you will be saved. Get it? Otherwise, you will be frustrating the efforts of the clinicians, nurses, and others when they are giving care. It is teamwork. The health workers out there who are already qualified, this is about you. This is not a matter of only interns, because they are doing a lot together on the wards. We have already shortages and we're having a lot of work. So all of us must come together. So our process is that we reject this policy, okay, to be implemented, should not be implemented in its current state. There must be a review and we must come back to the drawing table. Thank you very much.
Thank you very much, Dr. Lutoti.